Okay, so I'd like to introduce Dr. Susan Massey, who is giving our featured presentation today on the war on health. Susan did her PhD at the University of Washington, focused on mathematical neuro-oncology and neuropathology. During college and grad school, she was a caregiver for her mom, who had leukemia, and she co-parented a much younger sibling until her mom passed and her sibling graduated towards the end of her studies. She did postdoc and was a staff scientist at the Mayo Clinic in neuro-oncology, and then spent a few years at a small biopharma company. She's now at Arizona State University as a research software engineer supporting the development of computational infrastructure for population health. And Susan is an at-large member of Radical Women in Arizona. So take it away, Susan.
All right. Thank you for that introduction. As you can see, I've had a lot of different angles of exposure and experience with healthcare and health research. And wow, what great timing for this talk. I think we were talking a little bit as folks were coming in. It's been quite a week in the current administration's war on health. And so what great timing for this meeting. I, of course, want to start by noting that the views I express here are my own and not those of my current or previous employers. In fact, we may have some important disagreements. Secondly, there are many attacks in this war, and I will not be able to cover all of them here in the interest of time. Certainly to correct all the misinformation that is floating around, but I'm happy to field questions at the end. If folks have questions, or hopefully we can get into that a bit in discussion. This has been a year really fraught with uncertainty and real challenges for health in many directions. We've seen cuts to public health research funding, cuts and shakeups undermining key public institutions that were set up to protect our health, including at Health and Human Services, the Centers for Disease Control, the CDC, Food and Drug Administration, the FDA, National Institutes of Health, or NIH, Occupational Safety and Health Administration, OSHA, as well as the National Science Foundation, the Environmental Protection Agency. Many of these have been in the name of fighting against wokeism, or DEI, diversity, equity, and inclusion efforts, which were aimed at reducing inequalities in health. And I know people who were working on these things and did see funding get cut to those projects. And so I want to emphasize too that these cuts aren't just something that happen, in the news in some far off place or some remote thing. They are far reaching. They impact our local public health departments, which are primarily federally funded. So in our rural counties where there might be one person doing all the public health work in that county, they're already under a lot of strain. And so this does nothing to help support them. And of course, it impacts research programs that are focused on improving our health and also employ people in our local communities. This week we also had that press conference that misinformed the public about the use of Tylenol or acetaminophen during pregnancy, which is important for treating fevers as well as pain. Pain is important to be able to treat. I think we need to say that. And it was done using ableist and eugenicist language about autistic people to boot. They also spread misinformation about vaccines. And in recent weeks, the new COVID vaccine guidelines have made it difficult for people to access the shot, even with a doctor's prescription, as there's confusion about what insurance will cover or reimburse for with that changed guideline. We also heard this week that the FDA is going to take up a review of mifepristone at the administration's urging, catering to anti-abortion extremists. There has been renewed attention on the issue of medical abuse and forced sterilization of people in ICE detention. And there are people in ICE custody with life-threatening conditions who are unable to get necessary treatment. And just to top it all off, we are possibly a few days away from seeing new cuts to Medicaid come down or a government shutdown. Um, of course, health is broader than medicine. It includes being able to get adequate nutrition, safe drinking water, breathe clean air, have safe and secure housing, being able to access informational resources and transportation. Cuts to food assistance programs like WIC, SNAP, school lunch programs, housing assistance, public transportation, and broadband infrastructure, which enables telehealth in rural communities. These are all also attacks leveled by the administration in this war on health. Now, what about the Make America Healthy Again movement, or MAHA, right? They often sound like they're interested in improving health, and the emphasis on nutrition and doing your own research resonates with many. And it can sound empowering. In the presence of systems that have failed them, personal health sounds like the solution. Many of them, of course, have appropriated the pro-abortion, pro-choice movements, my body, my choice, in theirs for personal health. They feel they have the right and should have the personal choice to buy raw milk and boil it. I don't know if people have heard that they have rediscovered pasteurization, apparently by another name. Not getting vaccines also is a personal choice. And spreading distrust of doctors and so-called experts who are kind of part of this machine. But I really want to stress that it's important to distinguish between the leaders and followers here. Many of the leaders in this space are grifters, and this type of behavior isn't necessarily new. We've seen a lot of people selling ineffective Band-Aids for a broken healthcare system over the years. I think of Dr. Oz, for example, or Gwyneth Paltrow's Goop. The only thing that's really new here is their ability to influence institutions that previously kept them in check, and their pitching of and emphasizing isolated personal choices, which are often only accessible to those with enough monetary resources, distracts from the real issues impacting people's health. And those people who have been impacted are sometimes the followers just looking for solutions, who can sometimes feel really desperate. But who is most impacted by the attacks in this war on health? Often there are people who are left out of the MAHA discussion. Poor people, rural, women, children, and pregnant people of color, immigrants, trans folk. The last one is really a whole talk of its own, right? With all of the attacks that we've seen on transgender affirming healthcare and other trans rights for trans youth in particular. And so where is this coming from? Popular support for things like MAHA grow from years of being failed by the private health system. We have an emphasis on medicalization, or viewing health in a very narrow sense of being something that happens in the doctor's office rather than the holistic view of health and needing to support people broadly. And even in that system, there's often little time to ask questions or develop a relationship with a doctor. We see limited access as hospitals are consolidated and rural hospitals close. There can be long wait times to get in, even in urban areas. These big consolidated hospital systems may rely on traveling doctors and nurses, so that those folks providing healthcare are not necessarily part of the community, which just further undermines the ability for people to really form relationships with their healthcare providers of trust and being able to ask difficult questions and really feel seen and understood by their providers. We also have increased costs as we see big pharma, insurance companies, and hospital administrators increasing profits. People have also been failed, of course, by previous reductions to social programs and environmental injustice, which shift more people toward being sick further straining the healthcare system rather than being able to really emphasize prevention. Also limited support for caregivers and long-term care for folks with chronic conditions and different abilities who often, and mental health care, right, is also often not adequately covered. And unfortunately, cuts to Medicaid will further strain a lot of these things. Even if you're not receiving Medicaid yourself, it's going to strain a lot of the systems, and the impacts will be felt broadly. And, you know, just kind of hearkening back to this week, cuts to Medicaid will further strain families with autistic kids. You know, if they really cared about autistics and their families, they would talk to them and probably find out that they really need a lot more structural support rather than lobbying supposed causes at them, spouting blame and all this other nonsense that really what do I want to say? It really undercuts the value and contributions that autistic people make, right? We need support and accommodations, not othering of people with different abilities. So that's just a really high level overview of a lot of the things that I think we're confronting. And so I want to talk a little bit about what we can do, and I hope we can really discuss some ideas here in that front as well. Obviously, if we need to fight what we can. I'm thinking in particular, though, of the words of Clara Fraser, a longtime a Radical Women founder and longtime member and inspiration for folks who pointed out that really, rather than fighting on all these fronts and exhausting ourselves, what we really need is a quick, swift revolution, uproot everything and fix it there, because as we've kind of gone through this laundry list, there is a lot to fight against. I'm going to put a link in the chat. One little thing that we can push for short of that is the pressuring for the removal of RFK Jr. And folks like him who are spreading misinformation and really fanning the flames of the war, launching new assaults. But we also, of course, want to fight for a better healthcare system that is free and accessible, that really accessible to all. We also need changes. We have a lot of really good stuff coming out of our publicly supported research institutions. And attacks to that are I think a lot of people are unable to really see the benefits of those. I was explaining to someone that a lot of our taxpayer dollars have really funded the discovery of a lot of therapies and drugs and things that really help people and improve health. But oftentimes it's disconnected because you are not allowed to be, because of the way our system is, that has to be developed and pushed out through a company, and public research is not allowed to compete with companies. So even if you're offering services, I had a discussion about this recently in something else, but you have to price yourself in such a way that you cannot compete with private industry. You have to lower your prices, which is fine for things like healthcare that we want everyone. We work in health, we do research because we want people to benefit from it. But in order to make a product, our system forces us to push it out through a company which often focuses on profits. Some of those things that are developed will never see the light of day because it's not profitable enough for companies. There are a lot of challenges there. So I think that's something too that we can push for in our fight, is that we get to more directly benefit from the inventions that we support with our public research dollars. And that's just one of the things I wanted to raise here as well. I apart though from it's so hard. I just want that quick, swift revolution to fix things. So I'm leaving this kind of open ended rather than giving a conclusion. Um, how do we fight for that? How do we make sure that the needs of everyone who has been hurt by the system are better represented? And let's fight for that instead of being exhausted by every new nonsensical thing that comes flying at us. How do we make a better healthcare system that works? Another solution I might propose would be increased support for allied health workers, not just physicians, right? There are a lot of people doing great work as midwives and nurses. We need support for them as well and other healthcare support. But I do really want to open it up now to hear from other folks. What would you like to see in a better healthcare system?
Thank you so much, Susan. Yay, I see silent Zoom claps. Well, Susan not